Hey guys, it's lockdown two at day 19. Coronavirus day 406. So let's get to it. So we have a sort of lower cases today. Okay, still dangerous. So we have 3,682 coronavirus daily cases. So so let's see. Toronto and Peel region are still in the high. With Toronto and with 1,131 really high cases. And 507 high cases from Peel region. .436 from York region, 279 from Ottawa, and 200 and Durham region, from Durham region. So all other regions reported under 200 cases. So 40 deaths have been reported, a new record high. So it's kind of pretty much dangerous. So variant cases, of course. Let's start off with variants. So the UK variant is the most dangerous threat to us right now, with at 44,205 UK variant cases. Okay, to break down the term cases is it's just like a number of people affected by a certain disease or If I really have to break that down for you, wow, you didn't really take your time and literally look that up on Google or Bing. Wow, I can't believe, wow, how stubborn some people, or Microsoft Edge, how stubborn are some people. Because I had to respond to already just two comments from stupid people from and who couldn't like I had to tell some people, if you're going to just force me to kind of break this down, just look it up. There's something that you can look up yourself. So UK variants increase is literally plus 2,810. So that's pretty serious. There's also a steep ramp up. The 113 South African variants, which is a +5, and 218 Brazilian variants, which is a +6. So with the Brazilian variant still in the second place in out of the variants, and are compared to coronavirus case. cases, it is like the third most dangerous thing, and fourth most dangerous thing the is the South African variants. But they're all dangerous. So if you want to book vaccines or something like that, so vaccines bookings are for people 40 plus, or if you have a special diagnosis like me, you can book. Yes, just mention it. You know when. So go if you want to book online. Go to ontario.ca/book vaccine, or if you want to book online, you can by phone. You can call 1-888-999-6488. So stay-at-home rules are until May 5th. So I've listed that down below. So, and of course, there have been new rules that have been enacted since and changed because it was even Doug Ford. We finally had Doug Ford realize, oh, he went too far. So yeah, pretty much. So some rules have been changed again. So there. So I'm just gonna show the border rules again. So they're like the Ontario Quebec border, and will be there will be like a OPP and Quebec provincial police monitoring the borders, and also and any crossings, bridges, and also the Highway 401 Auto Route 20 that and where it changes as soon as you cross the Quebec provincial border, and also so there are some specific reasons why. I will show you. You can read that down below. I've explained it to you for the past three days, so you should probably get used to it by now. And also, there's no specific rules for the Manitoba, because they never really released that, but I'm quite sure they might. Manitoba has their own rules. They didn't just release it or anything. And of course, Quebec's has specific rules. So now to get to the matter of my topic, I want to talk about today is ICU again. So hundreds of coronavirus ICU patients are transferred for the next 2 weeks. So Dr. Chris Simpson the executive vice president of Ontario Health said he said the next 2 weeks will gonna just be horrific. So there's some questions that needs to. So every discussion we have, everything is about how are we going to get those health human resources in there. How are we going to get more ICU capacity? How can you accelerate those transfers even more? And how can healthcare workers work in different ways without pushing them too far out of their comfort zones? So yesterday, Humber College Hospital, Humber River Hospital, the Laura Mailing and also Justin Moreno had they have mentioned how it's been traumatizing to see patients that they are taking care of, even no matter how hard they are, like trying hard, doing in their best to treat these patients and have them recover. Some people, unfortunately, they will not make it, and of course they're trying their best. So. And some people got traumatized. They they got burnouts, or they just it was too much for them, and they just quit their job. And to work in like the critical care ICU situation. Well, it's not just like working like a regular nurse. There's like special things that you have to like learn about. So there are 2,200 critical care beds in Ontario right now, with couple hundred more to be added shortly. So don't forget, but the matter that we have to remember is it's not just coronavirus patients and ICU. So some people are there because of accidents, heart attacks, and other critical care issues that needs. So and also there have been transfers from where patients, ICU patients, are being transferred to hospitals from Toronto to maybe out west to at least London. The hospitals in London, and also north up to Northern Ontario hospitals, and also some patients are coming in from other states, even places, towns and cities, even from Oshawa, that area, and also patients, adult patients have not been moved, and of course so sick kids has to deal with their own problems with adult patients being transferred from these adult hospitals to sick kids, and they have to make several hospital beds specifically for these patients that have been transferred from these other hospitals. So they're having an issue there. So they're gonna they're most likely airlifting these patients or drive in critical care hospitals from hotspots like the Greater Toronto Hamilton area to less affected areas with simply open beds to fill up. So Dr. Bruce saw someone's said said that there have been transferring ambulances up to 25 patients a day having been moved from hospitals and hotspots to. So if you've been driving, so if you've ever been on the highway and you notice a number of hospital, yeah, like an ambulance is going by, yeah, most likely they're transferred. So Kingston Health Services Center said that they were caring for all 46 coronavirus patients from out of the Kingston, Frontenac, Lennox, and Addington region, and they also had to add in more ICU beds during the pandemic, and now it's 96 critical care beds and 78 ventilators. So a lot of patients and there's also an adult hospital, and they're sending it to hospitals in Ottawa, and as well. And I'm not sure. If Children's Hospital of Eastern Ontario will also be forced to make up the adult hospital ICU beds like SickKids is doing. But there might be it's what's concerning me is the number of ICU patients versus the number of critical care ICU nurses who take care of these patients, and let's just say, and from what other nurses have said, some get traumatized, some get burnout, and some people, and Dr. Moreno even said he's seen his colleagues just quit the job. So, but will we have enough critical care nurses in at these hospitals who can take care of these patients, and they will not end up having a burnout, or they will not get traumatized, or will they? Because there's like some women nurses who they get pregnant, they need to take a break for maternity leave, but who's going to fill in their spot, and will there be enough people to take care of this all? Which brings me to hospitalizations. So we have 2,353 550 people hospitalized with coronavirus, which is a plus 15 compared to yesterday, which is sort of went down and then it's back up again. And there's a new record of 806 ICU patients, plus 16. And 588 of these ICU patients are like using a ventilator right now, so plus 22. So I just hope it's not too much pressure for the nurses, but like these, special, like the ICU specialist at Humber River Hospital. There to take care of these ICU patients. These critical care nurses, they need to have special qualifications to do so. So don't forget that. Lockdown ends April 30th. Long-term care home deaths is still at 3,755 since April 5th. There are 37 outbreaks right now, plus 3, an increase. So please follow coronavirus safety rules and regulations, lockdown regulations, and stay-at-home rules. Don't have any gatherings. The major concern right now we need to focus on is trying to lower coronavirus cases, lower ICU patient numbers, and also lowering the UK variant case numbers. And just hope that the ICU patient numbers drop, because sure, I have nothing in the medical field, but I can understand the pain these critical care nurses have to go through when they witness someone dying. This is the patient that they're caring for, and they witness someone dying, and it can be tragic. Which kind of explained why some nurses, like Dr. Justin Moreno, said they bailed and just quit the job because it was too much for them. Stay safe.